So Eva Mendes just admitted and showed pictures of her having a treatment in the submental area, and she said it was mono threads. We talk a lot about threads on this channel. I'm going to go through today what she had done, what it is, what it's supposed to do, why would she have it done with a jawline of perfection. And she's about 46, 47 years old, I think. Why would someone like that have it done? What does it mean for you? What can you take away, and what should you do based on what the stars are doing? How long does it last, and how much would that cost? We're going to go through it all today. This channel is all about giving you the information that you need to make great decisions for what you might want to do for aesthetic services, and to give you an idea of cost, longevity, safety, and a plethora of other metrics so you can make a great informed decision. If you like that, stay tuned here, subscribe, like this video, and we're going to dive right into it, along with a facial analysis at the end, because she made my top 5 lip fillers of celebrity stars, and we did that video. I'll tag it onto the end so you can watch what is it about her now that makes her so beautiful and perfect with golden ratios, and what we can learn from that. Okay, so from this picture, you can see the threads being placed. She said they were mono threads and that they didn't hurt that much. And someone else had this done. Yours truly. Remember my video from a while back? I showed you my treatment. I didn't use any numbing. It doesn't hurt that much. She's absolutely telling the truth. And good on her for coming out and saying what she had done and admitting it, and even posting pictures. Pretty cool that celebrities, some of them, say what they had done so we can follow and learn from them, because it's who a lot of us looked up to, and look at the pictures, watch them age very carefully, and determine what they may or may not have had done. So when they admit to it, it really helps the general public, and it creates a sense of trust with the people that we follow so closely. So these are mono threads, and I'm guessing they're likely PDO. There's also PCL and PLLA type of threads, and I go through each one of those in my other videos. So PDO or polydioxanone are going to be placed. You can also mesh them sideways, but they dissolve at roughly 1 to 4 months depending on the thickness, and my guess is these are 29, 27 gauge, something like that. And as they go away, they build collagen around them. And you can see from this diagram here how there's the thread placed, and a few months down the road, you see with the staining, there's increased collagen production around the thread. When the thread goes after a few months, that collagen stays. Now, why did she want to do that? Obviously, she has a perfect jawline, but we lose collagen as we age. Collagen and elastin break down. We know that the machinery of the body isn't what it once was, so we're trying to replace it. Things like biostimulators, like Sculptra, they build collagen, so we know that very well. But PDO, polydioxanone, can be put in as a thread, a mono thread as she mentioned, or it can in some countries be found as a liquid, which is a biostimulator. So in any case, a thread or liquid, we're stimulating collagen, because collagenases, what we call MMPs, matrix metalloproteins, all work to get rid of that collagen, and we get sag. So what she's doing is preventing, and she's preventing a sag and the tech neck. When people look down or look right to left particularly, you'll see the skin gets loose, even if there's no fat. And it's one of the reasons why we like to keep some fat in the neck, because fat, of course, is stem cells. It's youthful. We don't want a fullness, but it helps with tightening. Not everyone has a lot of fat, so you need great collagen. So threads can be used with RF microneedling, with RF VFR, so more of a topical RF, or bulk heating like Ulthera high frequency ultrasound as well. So they can be used with all those, and I show videos of that being done together in my other videos. You can watch those. So how long will it last, and how much does it cost? All great questions. Aging rate being reasonable, and no big hormonal changes, and some general skin maintenance with topicals, retinoids, and so on. Most people will repeat this in my practice, what I do, repeat it at about 6 to 8 weeks. And then they're good for a year. And then maintenance really depends on how perfect people want it to be. And if their aging rate increases, if they're out in the sun, if their hormones are changing, loss of estrogen is what I mean by that. They're not using skincare or retinoids, then you can repeat them sooner. But for most people, once a year is a good rule of thumb. And ancillary services like high frequency ultrasound or radio frequency in many forms can be used along with the threads in between sessions. So how much does it cost? So a lot of times we talk about lifting because in America everyone's lifting threads. That's $2,500 plus for one session. When you're talking an area like this with mono threads, $500 to $1,000 per session would be normal. I would include 2 sessions in the package because I know I want to get that second session into the patient because that's going to give the best result. Sometimes just doing it one time, especially if there's lax skin to begin with, it's not going to give them the result they need. You need to stack them. But once you get what you want, oftentimes repeating it once a year, it's very cost effective to do. And if it lasts 2 or 3 years, it's a win-win. Okay, so let's look at a facial analysis with attention to her lips and see what's creating her beauty in the first place. So Eva Mendes. So if we look at her face, and particularly today we're looking at lips, but of course the whole face has to fit in harmony. A slight canthal tilt upwards in the eyes, nice straight nose. The bigonial width is a little bit less than the bizygomatic, so a little bit of a V-shaped face, which we look for, although square can be in, and again, a narrow chin. As we age, of course, this becomes square. So before we even do lip fillers, we're looking at all these angles. Why? People come in at 40 and 50, this is already square, so we have to address by lifting up the face before we can do lip filler because it will look unusual. Or if the chin is square, sometimes we make it a little narrower by doing chin filler at the same time. Now, if we look at her lip shape, we draw a line right through the center, right below the nose, into the chin. We would expect this to be 1 to 1.61, a golden ratio. Now you see she runs a narrow ergotrid, okay, so that area is narrow. You don't notice it as much because the beauty of the eyes and the beauty of the shape of the lip. Now, motor muscle movement makes a big difference in how we accept the look, and we're going to look at a picture of her smiling. However, also notice there's an asymmetry. She has a slight smirk as evidenced by these lines laterally and only one on her right. So if you look here, that motor movement here might lead to this asymmetry in the left upper lip. I'm telling you this because I don't want you to be focused on the asymmetry of your face. We're all asymmetric in many different ways, and when we do fillers, we're always working towards symmetry. However, a degree of asymmetry is normal. This is likely motor movement, and at rest she would be symmetric, okay? So symmetry, and I know you guys want a whole video on symmetry, and let's see what we can do. I'll keep it on the radar. But the ergotrid is short relative to the chin distance, but she runs it because of the beautiful eye and beautiful lip volume, of which she's right about 50-50. My whole video on the 50-50 lip many years ago, people were like, 50-50 lip. Now, in fairness, where is her family from? So genetics play a role. She was a descent of Cuban descent. So as you see, different ethnicities have different ratios. Okay, we have to take this into consideration. At this point in time, people can have what they want, no matter where you're from. A lot of times we can create it with fillers or surgery. She was, I believe, born in New York, brought up in LA, something like that. So ancestry is important. Let's look at one more picture of her smiling. Okay, so here she is smiling. Motor movement plays a big role. This is her youthful state, of course, prior, and this is a more recent photo, and you can see a lot of similarities. Some things that look a little different or may have changed, not the reason of this video, but of course I get distracted. But look at the size of her teeth, whether she grew into them or it's not uncommon to have them adjusted for shape. It's very easy to remove a little bit of the inferior teeth, especially people do it in the front. But some changes you might see, but definitely had some volume in the lip here. Now, do you see an asymmetry? Okay. Again, she's smiling. We see again, there's more lines on this side, so that fits. I'm not worried about those. Those can be treated one of many, many ways. Minimalistic. There's nothing needs to be done there. But you want to be preventive because they will become accordion lines. What's that have to do with lip? Again, the lip is really all about the whole lower face. I do want to show a little bit of asymmetry here. So for those of you who are absolutely fanatical about symmetry, notice that this is larger, this is smaller in the smile. We don't really notice that unless she might, but no one's going to notice that. And you can see even here laterally, there's it even looks like, could be anything, old scar tissue, it could be natural, it could be a little bit of lip filler, who knows. Bottom line, when she smiles, it's a nice symmetric smile. Okay, and that's a lot of times it's motor movement that we're looking at. Okay, so the motor movement as opposed to the actual symmetry of the lip. But if there was an untoward symmetry, we would know, and we would look and it would be distracting. And you don't hardly even see the mole that's right here, because what are you looking at? The beauty of the teeth. I'm going to do a whole video on the teeth and the smile, and the beauty of the eyes and brows. It takes over. Even in this picture right here, there's not a lot, because it's a fuzzy picture, there's not a lot of skin glow, but you just notice that big beautiful smile. If we draw the line down from the lateral limbus, lateral colored part of the eye, when she smiles, see, a lot of people would say the lip should go from the inner limbus or even the center of the eye. Okay, I always, in my videos, you'll see me talk about the lateral colored part of the eye, which is right along this line here, because models, stars of the world, have generally a wider mouth. Not always with the K-pop stars, but in the American culture, it's a common denominator. So I created a whole playlist on threads for you here. You can watch that, get educated on the threads. Hats off to Eva for showing us what she's doing to stay absolutely gorgeous. Stay tuned here to keep your skin and body beautiful, healthy, and vibrant.